Good day, friends. I am Dr. Sanjay Kalra, your friendly endocrinologist, and you are watching Dr. KK's MEDTalks, Mondays with Dr. Sanjay Kalra, non-stop show. Today is our 355th episode. आज हमारी 355वीं episode है. Let's have the headlines for the day. Our headlines for today: new post-infection treatment with protease enzyme inhibitor has been identified for COVID-19. So this is good news. We are getting more and more arsenal, more and more weapons in our fight against COVID-19. CoWIN will go global today, and 50 countries have shown interest in this Indian innovation. Our Prime Minister Narendra Modi ji has addressed the CoWIN Global Conclave, where countries that have shown interest in our government's digital platform have got an opportunity to adopt it. There is an issue, however. Detection of bone death in COVID survivors has become a cause of worry for doctors. But on the bright side, Indian scientists have been working on developing an mRNA vaccine technology. Let's go to our topic for today. Our topic for today is diabetic foot, or in general, foot care. Warm greetings to everybody who is logged in, Aruna Tyagi ji, Poonam Pal ji. And let me introduce our special guest for today, Dr. Yovan Mahadeb. Dr. Yovan Mahadeb is from Mauritius, our sister country, our brother country. हमारे अलग-अलग देश नहीं, बिल्कुल भाई कहेंगे हम मॉरिशस को. Dr. Yovan Mahadeb is an endocrinologist there. वो diabetes और hormones के specialist हैं. And he is also president of the Endocrinology and Diabetes Association, Mauritius, EDAM. डॉक्टर साहब के खूब सारे publications हैं in the field of diabetes and autoimmunity, immune disorders, diabetes, cardiovascular disease, इन सब में इन्होंने शोहरत पाई है. He works as a senior specialist in the healthcare system in Mauritius. While we wait for Dr. Yovan to join us, we'll talk about diabetic foot specifically, and we'll also talk about foot care in general. तो अब हम पैरों की बात करते हैं. अब हमारा जो शरीर है, our body, it stands on our feet. Unfortunately, sometimes we don't give proper respect to our feet. Actually, if you look at traditional Indian culture, the feet have always got place of pride. हम जब किसी बड़े को मिलते हैं, हम उनके पाँव छूते हैं. हमें जब blessings चाहिए हों, तो भी हम पाँव छूते हैं. So whenever we meet someone elderly, we touch that person's feet. If we want blessings, we touch feet. And this is actually the importance of feet in the body. Unfortunately, the feet are neglected in medicine many times. And namaskar to Dr. VK Arya sir and Aruna Tyagi ji again. When we look at the feet and we see how much importance they have in our body, in our day-to-day life. Without them, we can't walk, we can't run, we can't work. Compared to that, we don't give adequate importance to our feet. We all know of heart doctors, cardiologists. We know of respiratory doctors, nerve doctors, neurologists. We know of endocrinologists, hormone specialists. We know of surgeons. But there are very few foot specialists. Very, very few foot specialists. Why is this? Is it because we have less foot disease in the country? And ऐसा बिल्कुल भी नहीं है. So many people have feet disorders. हम सब जो gathered हैं, all of us will immediately say, हाँ, कभी मेरे पैरों में दर्द होती है, कभी पैरों में infection होती है, कभी खारिश होती है. Sometimes I have a pain in my feet. Sometimes I have irritation or I have tingling in my feet. At other times I have a swelling over my feet. पैरों में सूजन होती है. कभी-कभी जख्म हो जाता है. We might have an ulcer. So there are so many things that can happen to the foot. Why then do we not take care of it? We don't know the answer to that, but let's focus now on foot care today. So first, we'll talk about how the feet help us. Secondly, we'll talk about all the various issues that can happen in the feet. Then we'll talk about foot care, and we'll focus a little bit on diabetes care as well. Best wishes from Rajiv Kumar ji, and welcome to the show. Let's talk about our feet. अब हमारे 2 पैर हैं, 5 उंगलियां हैं, और इन पे पूरी बॉडी का बोझ रहता है. There are many bones in the body, in the feet, which take care of the entire burden of the body, the entire weight of the body. All these bones are supported by muscles. So हमारे पास हड्डियां हैं और हमारे पास मांसपेशियां हैं. These help us live life. We need strong feet because let us say हमारे पीछे कोई शेर पड़ गया, कोई चीता पड़ गया, then we have to know how to run. So if we don't run properly, we won't be able to survive. To ensure that we are able to run properly, feet की एक particular एक structure होता है पैरों का, जिसमें एक arc होती है. So you can run properly. There are some people with flat foot. ऐसे flat होगा, ये लोग इतनी तेजी से नहीं दौड़ सकते. मगर जो ब्यूटी है आजकल साइंस की, डिपेंडिंग अपॉन योर फुट स्ट्रक्चर, यू कैन क्रिएट कस्टमाइज्ड रनिंग फुटवेयर. अगर आप भागना चाहते हैं, आप स्पोर्ट्समैन हैं, आपको लगता है कि आपके पैरों का स्ट्रक्चर सही नहीं है, यू कैन ऑलवेज गेट कस्टमाइज्ड फुटवेयर. सो कमिंग बैक टू द एनाटॉमी, वी हैव बोन्स, वी हैव मसल्स. इन बोन्स और मसल्स से काम करवाने के लिए हमें इनको खाना पीना देना चाहिए. वी हैव टू गिव देम न्यूट्रिएंट्स. These nutrients come from blood vessels, खून की नसों से. और जब हमारे पैर काम करते हैं, मान लो उनको चोट लग गई, उनको कोई दिक्कत आई, तो हमें पता कैसे चलेगा कि हमारे पैर खुश नहीं है? वो हमारी नर्व्स या नसें हैं जो हमें मैसेज भेजती हैं हमारे दिमाग को. So warm greetings, Dr. Yovan. We've already introduced you. Dr. Yovan is a senior endocrine specialist in Mauritius. And we were just wondering, Dr. Yovan, is Mauritius and India, are they brother countries or are they sister countries? What do you use? What terminology do you use in Mauritius?
Well, thank you very much, Sanjay. Sorry for this delay. Had a few communication issues. So you've already called me your younger brother. So I would say India is our bigger brother, I would say. And thank you for having me. I hope that we can discuss. This discussion can be very interesting for all of us. You have to excuse me for my Hindi. My Hindi is not that good. I can understand well, but I'll try to chip in a few words of Hindi.
That's fine. You have lots of people gathered in to listen to you. You have people from Mauritius, from India. Salil Chadda saying hi to you, and also from Muscat, Oman, from where Tulika Pal sends her greetings. And one of our senior most doctors in the country, Dr. N.S. Sharda. Sir is a graduate from Sindh in Pakistan. Now he's working in Gujarat. He also sends you his blessings. And also Kedar Joshi ji, one of our senior most persons, Dr. Kedar Joshi ji ki taraf se bhi blessings. So Dr. Yovan, we were speaking about foot care, the importance of foot care. And we were wondering, why is the foot so neglected? Is it true in Mauritius, like the heart specialist, the diabetes specialist, the kidney specialist, all these are big specialists. Everybody respects them. Do you have foot specialists there?
I think that's a very good question, Sanjay. I think going through my studies, going through my training, I've been trained in Belgium, and when I came back to Mauritius, I thought that the thing that struck me the most, not only I would say in terms of the disease, in terms of the epidemiology, it's the way that it's being catered for. It's the lack, I would say, of multidisciplinarity of the issue. I think that in like many diseases, you take like oncology, you take like other diseases where you need a team of specialists. I think that the most important problem is Mauritius is that lack of multidisciplinarity. As you were saying, when we are having, for example, a surgical foot, sometimes I find myself in very difficult situations where I need to have an expert opinion on a foot. I mean, it's not merely an amputation. It's not merely a debridement. Sometimes it's very complex. Maybe we'll have the chance of speaking about that. But I think that the most important issue for me is that when you don't have multidisciplinarity in the management of foot, it's a big problem.
Yeah. So Dr. Yovan जो कह रहे हैं कि foot care मुश्किल है, इसलिए मुश्किल है क्योंकि बहुत सारे लोग चाहिए इसका इलाज करने के लिए. मल्टीडिसिप्लिनरी, हमें नर्स चाहिए, हमें पोडियाट्रिस्ट चाहिए, मेडिकल डॉक्टर, सर्जिकल डॉक्टर, और जैसे हम बात कर रहे थे, छोटे से तो हमारे पैर हैं. In general, as related to the rest of the body, the feet are not all that large, but they contain nerves, they contain blood vessels, they contain bones, and they also contain muscles. So there is so much of anatomy, इतनी सारी complications हैं इसमें, complications के chances हैं. But we are lucky, Dr. Yovan, we have with us Dr. Girish Chatle and Dr. R.S. Chaudhary. Both are very senior and respected foot surgeons from Haryana. So thank you, Dr. Chatle, and thank you, Dr. R.S. Chaudhary, sir, for joining us. In case we have any difficult questions, so now, Yovan, you know whom to refer to.
Okay, right.
But let's take things one by one. Dr. Sharda reminds us कि आप अगर माता के पैर छुएं, touch your mother's feet or the goddess's feet every day, that reminds you of the importance of the feet. Thank you, sir, for that. And many other friends greeting you, Yovan. Narinder Rana ji, Awadh Kishore Rathore ji. So you have a huge fan following now in India.
Right.
Let's talk one by one. Let's talk about nerves first. So what is the importance of nerves in the foot? And what kind of complications do you see when the nerves gets damaged? Whether in people with diabetes or maybe in the elderly, in anybody, just feel free. What do you see with relation to nerves?
Well, when you look at statistics itself, it speaks volumes, actually. So as we all know, the majority of amputations come from ulcers. And from ulcers, the vast majority, in a recent study, it was like 85% of ulcers come from neuropathy. So one of the earliest signs of foot problems, is neuropathy. And I think it is our duty to be able to diagnose neuropathy at a very early stage, even before the apparition of the ulcer. And of course, we have got a lot of tools for that. But of course, like the monofilament, of course, and of course the tuning fork. I think it is very important already to tell patients that what will bring neuropathy is poor control of diabetes. We have seen over such a long period that many studies have shown that microendopathia is mainly due to chronic poor control of diabetes. UK-BDS extra have shown brought these conclusions. But we have to tell the patients, we have to start with the basics. The basics are getting the patient to know that they have to get the diabetes under control from the first place. Second thing, I think we have to think about other causes of neuropathy, because it is not merely diabetes itself. You've got, of course, there are quite rarer vitamin B12 deficiencies. You've got like hypothyroidism. You've got like less, I would say, even more probably a bit more frequent is lumbar stenosis. So we have to look at all these. Uremia, for example, also can give neuropathy. So we have to look at these other causes of neuropathy, and be like not concentrate, I would say, merely on the diabetic aspect, and be aggressive in the treatment of neuropathy. If you can reverse the neuropathy, probably that will help the patient. I think that is the most important thing.
So we are talking of nerves. हम नसों की बात कर रहे हैं, और नर्व्स की जो बीमारी है उसको बोलते हैं न्यूरोपैथी. तो डॉक्टर योवन ने हमें अभी क्या पढ़ाया? एक तो न्यूरोपैथी को डायग्नोज करें. बहुत सिंपल तरीके हैं डायग्नोज करने के. मोनोफिलामेंट टेस्ट या ट्यूनिंग फॉर्क, डॉक्टर साहब ने इनका नाम लिया. जब आप अपने डॉक्टर के पास जाएं, आप कहें कि आप मेरे पैर एक बार देख लें, एक बार छू लें, एक बार देख लें कोई दिक्कत है कि नहीं. बिजी ओपीडी में कई बार दिक्कत होती है, कई बार लोग नहीं देख पाते. तो पर फिर भी अगर आपको ऐसा लगता है कि आपके पैर पे कोई हाथ लगा रहा है, आपको पूरा पता नहीं चलता, या गर्म या सर्द का आपको नहीं पता चलता, यू आर नॉट एबल टू डिफरेंशिएट बिटवीन हॉट एंड कोल्ड. Somebody in the family says the water is so hot, but it fell on your foot or on your hand, you didn't even realize that it's hot. That's a sign of neuropathy. तो पहले तो डॉक्टर साहब ने कहा इसको डायग्नोज करें. दूसरा डॉक्टर साहब ने कहा इसका ख्याल रखें. उसके दो तरीके बताए सर ने. एक तो ये कि शुगर का कंट्रोल करें. उन्होंने यूके-पीडीएस स्टडी का नाम लिया. यूके-पीडीएस एक बहुत बड़ी स्टडी थी जिसने हमें ये कहा कि यदि आप अपनी शुगर कंट्रोल करते हैं तो आप न्यूरोपैथी, आंखों की दिक्कत, किडनी की दिक्कत, इन सब से बच सकते हैं. हमने कुछ एक महीने पहले बात की थी मेटाबॉलिक कर्म की. डॉक्टर योवन, वी स्पोक अबाउट मेटाबॉलिक कर्मा. metabolic karam, which will resonate in both India and in Mauritius. So the point is that whatever karam you did a few years ago, maybe you didn't take care of your health, of your nerves, that is going to influence your karam today, which is your present. But if we take care of our karam today, metabolic karam, that will influence our tomorrow. अगले जन्म में नहीं, इसी जन्म में हमें फायदा मिलेगा उसको. डॉक्टर योवन ने ये भी कहा शुगर का ख्याल रखें पर बाकी चीजों का भी ख्याल रखें. So it's not about glycemic karam alone. It's metabolic karam. Take care of thyroid. Take care of kidney. Uremia नाम लिया डॉक्टर साहब ने. Take care of vitamin deficiencies. Vitamin deficiencies are quite common in India. So these are all the things that we have to look at. And right now we are focused on neuropathy. In the meanwhile, Dr. Yovan, a warm welcome for you from Gariga Maheshwarji, who is from Hyderabad, and also from Prakash Vadwani ji, जो आपको हिंदी में सादर अभिनंदन कर रहे हैं. A warm welcome, a sincere welcome.
Thank you.
Gariga Maheshwarji also wishes you a belated happy National Doctors Day, which we celebrated on 1st of July in India. That was the birthday of Dr. B.C. Rao. We also celebrate Hygiene Day across the world because there was a doctor known as Ignaz Semmelweis. इन डॉक्टर साहब का बर्थडे भी 1 जुलाई को होता है. ये वियना में काम करते थे. He was a Hungarian doctor. इन्होंने 200 साल पहले देखा कि जो डिलीवरीज होती थी, लेडीज की, महिलाओं की डिलीवरीज होती थी, उसमें बहुत सारी लेडीज की डेथ हो जाती थी. एक ही अस्पताल में 2 प्रसूति घर थे. There were 2 different labor rooms in the same hospital. एक में दाइयां काम करती थी, midwives. दूसरे में डॉक्टर थे. जहां पे डॉक्टर काम करते थे वहां पे 3 गुना ज्यादा डेथ थी. उन्होंने जब ढूंढा कि कारण क्या है, उनको देखा कि जो दाइयां हैं, जो नर्सेज हैं, मिडवाइव्स हैं, वो अपने हाथ धोती थी डिलीवरी से पहले, डिलीवरी के बाद. जो डॉक्टर साहब हैं सारे हमारे, मतलब अब वाले नहीं, उस टाइम वाले, वो रोब से आते थे सीधा, चाहे वो डायसेक्शन करके आए हों, कोई ऑपरेशन करके आए हों, जैसे भी हाथ थे सीधा आके डिलीवरी की और वापस चले गए. वहां से कॉन्सेप्ट मिला एसेप्सिस का या हाइजीन का. हाइजीन मीन सफाई. और अब तो कोविड टाइम में तो सब हाइजीन की बात करते हैं, पर्सनल हाइजीन, सोशल हाइजीन, फिजिकल हाइजीन, मेंटल हाइजीन, ऑल दीज आर वर्ड्स. पर उस टाइम पे जो डॉक्टर सेमेलवेस थे, उनकी लाइफ ज्यादा अच्छी नहीं बीती. उन्होंने हाइजीन ढूंढी, हमारा फायदा करा गए, लेडीज का फायदा करा गए ताकि डेथ ना हो डिलीवरी के बाद. मगर बाकी डॉक्टरों ने बहुत ज्यादा पसंद नहीं किया उनकी स्टडीज को, और उनको फाइनली पागल खाने में दाखिल कराया गया, जहां बेचारे डॉक्टर साहब की डेथ हो गई. Which is not a nice ending. But Dr. Yovan, coming to this now, let's talk about hygiene. Now, let us say we have a patient with neuropathy. अब 20 साल से शुगर है, एल्डरली हैं, नर्व्स अब उतनी जवान तो नहीं है जितनी 18 साल पे थी. डॉक्टर योवन की तो जवान रहती हैं वैसे. This much Hindi, doctor. Yeah, देखो smile देखो. Dr. Yovan understands all the nice parts of Hindi. Yeah. So the nerves might become weak, maybe because of age, maybe because of diabetes, and maybe because of vitamin deficiency, right? So how can we maintain foot hygiene? What are the important things to do? What can we do at home? In the meantime, Vivek Mugdal and Anisha Vincent, Poonam Groverji, all saying namaste to you.
Hi everyone. Maybe one thing that I would like also on neuropathy is structural deformity, hamartomas. So yeah. these are further down the line where you have got already structural deformities, because it's not only the sensory part of neuropathy, it's the motor part, and motor part actually is an imbalance between the flexor and the extensor muscles, as you know, which causes deformity and which changes the whole structure of the foot. Maybe we'll have the opportunity to talk more about the Charcot's disease, which is one of the most eminent forms of neuropathy, I would say. And yeah, just coming back to your questions. So yeah, I would think hygiene is the basic. I always tell my patients when I talk about foot in the foot clinic that we have here, is look at your feet. Have a look. If you can't see it, get your feet in front of a mirror. We have kind of a telescopic, I don't know if you have that, in a telescopic mirror where you've got kind of a rod with a small mirror at the end of it, and then you can just pull it and then look at your feet with just hand holding it like this, actually. So you can see the sole of your feet, because sometimes you can't just lower yourselves or get your feet higher up to see the soles, or you have to ask someone to see whether the sole is okay. So hygiene is of prime importance. We'll have the opportunity to talk about fungal infection, onychomycosis, and these are known to be favoring causes of ulcers and starting points of infections. The fungal infections themselves often start from poor hygiene. Ulcers starting from bruises also often start from people who walk bare feet. Who, when you look sometimes at the I was thinking about the foot care nurses that we have in Mauritius, and when they look at the dressing, and when they look at the patient and tell them you've been walking bare feet, because when you look at this, at the way that the dressing is dirty, and you see that this patient has been walking bare feet at home, there's no other way. So even when people have got a dressing on their feet, they still sometimes, unfortunately, fail to maintain good hygiene. And it is our duty to help to talk about basics in terms of washing feet, in terms of finding using clean socks, in terms of using clean shoes, in terms of I would say looking at your feet, whether there are any things that could, any dirt on the feet that could favor different infections. So hygiene is key. I agree with you on that.
So डॉक्टर योवन क्या कह रहे हैं कि हाइजीन या सफाई, दिस इज द की टू फुट केयर. ये सबसे इंपॉर्टेंट चीज है पैरों की देखभाल की. डॉक्टर साहब बार बार हमें कह रहे हैं आप अपने पैर देखें, रोज देखें. अगर आप नहीं देख सकते तो शीशे का इस्तेमाल करें. यूज अ मिरर. इफ यू कांट यूज अ नॉर्मल मिरर, यूज अ टेलीस्कोपिक मिरर. इसकी लंबी सी डंडी होगी ऐसे, और आप अपने पैर का निचला हिस्सा भी देख सकते हैं. सो ये बार बार मैसेज आ रहा है, रोज अपने पैर देखें. अगर आप खुद नहीं देख सकते, किसी और को दिखाएं. सो दैट वाज मैसेज नंबर 1. दूसरा था इनको साफ रखें, रोज साफ रखें. लेट्स आस्क डॉक्टर योवन, डॉक्टर साहब, शुड वी वॉश आवर फीट विद सोप, with Dettol, with Savlon, with Betadine? I have normal feet. I don't have any ulcers. I don't have any bruises. What should I use?
I mean, there's no need, especially to go for Dettol, Betadine, etc. Plainly soap. If you don't have any ulcers, plainly soap, and washing them, drying them correctly. That is very important. Washing and drying. It's very important. So I don't think that you need to go to the extent of having. Well, if you're using them, it's not a problem. But it's not. You're not forced to be using these things to be cleaning your feet if you don't have any problems. So basic soap and water.
So two simple things, two important things which Dr. Saab has just told us. एक तो साबुन इस्तेमाल करें. आपको डिटोल या सेवलॉन इस्तेमाल करने की जरूरत नहीं है. शरीर पे अच्छे बैक्टीरिया भी होते हैं, गंदे बैक्टीरिया भी होते हैं. जब हम बहुत ज्यादा एंटीबायोटिक या एंटीसेप्टिक साबुन इस्तेमाल करते हैं, whenever we use antibiotics or antiseptics, we not only kill the bad bacteria, we kill the good bacteria as well. जो अच्छे कीटाणु हैं वो भी मर जाते हैं. तो जो डिफेंस मैकेनिज्म है हमारी बॉडी का, हमारी स्किन का एक डिफेंस मैकेनिज्म भी है. जब अच्छे बैक्टीरिया मर जाएंगे तो वो भी कमजोर हो जाता है, और उसका असर क्या आता है? फंगस आता है, या उर्ली उग जाती है, या हुई उग जाती है. अब गर्मियों के दिन हैं, आपके फ्रिज काम भी कर रहे हैं, बिजली भी नहीं जा रही, तो भी आप देखेंगे 2-4 दिन के बाद ब्रेड पे फंगस उगा होता है, उर्ली उगी होती है. तो ये कॉमन पार्ट है, खासकर गर्मियों में कॉमन हिस्सा है लाइफ का. तो पैरों को बचा के रखना है. नाउ सी टू थिंग्स which he highlighted for us. Wash your feet regularly using simple soap, and then dry your feet properly. That is very, very important. You have to dry your feet every day. He also talked about using clean socks. तो जुराबें पहने. और डॉक्टर महादेव ने हमें ये भी बात याद कराया बार बार कि आप नंगे पांव ना चलें. जो डायबिटीज नर्सेज हैं मॉरिशस में, वो इमीडिएटली पहचान जाती हैं भी कौन नंगे पांव चल के आया है और कौन ठीक चला है. ड्रेसिंग से पता चल जाता है. तो वी हैव टू टेक केयर ऑफ ऑल दीज थिंग्स. In the meantime, Dr. Aris Kataria saying Namaskar, Dr. Saab, to you. And again, Dr. Sharda adding in two very important pearls of wisdom. First of all, Dr. Sharda teaches us that you can use acupressure over the feet to help relieve many symptoms. And if you have a good qualified acupressure specialist, there's no harm in reaching out to them. Acupuncture is different. Acupuncture में क्या होता है कि सुइयां लगती हैं. तो जब सुई लगती है तो हो सकता है ब्लड में कोई इन्फेक्शन चल जाए, खासकर अगर कोई एल्डरली हो, किसी को शुगर हो, और मान लो वो जो सुइयां हैं वो अच्छे से डिसइंफेक्ट ना की गई हो, तो बहुत सारी बीमारियां जैसे काला पीलिया, हेपेटाइटिस बी और ब्लैक जॉन्डिस या HIV एड्स, ये सब खून के जरिए स्प्रेड होती हैं. सो एक्यूपंक्चर इज नॉट समथिंग दैट यू वुड रिकमेंड इन रूटीन. Acupressure, if you have a qualified therapist, no harm in reaching out. And that is what Dr. Sharda is saying. Dr. Sharda also reminds all of us, by touching the feet of elders, you are blessed. Thank you, sir, for that. And also, when you do that exercise, your own central obesity decreases. तो एक तो आपको blessings मिलती हैं, दूसरा आपका अपना वजन कम होता है, flexibility भी आती है, तो डबल फायदा है. So you are able to get double benefit. एक के बदले दो का benefit. We are talking of hygiene right now, and Garika Maheshwarji asks you, sir, what are the causes of cracked feet, and how can we prevent it?
Yeah, so cracked feet, often it's due to what we call xerosis. So dry feet, which mostly due to neuropathy in the first place, and which, because as we have discussed earlier on, you've got different forms of neuropathy. You've got sensory neuropathy, you've got motor neuropathy, and you have got autonomic neuropathy, because one of the most important aspects of autonomic neuropathy is to keep sedation, so that your feet are still moist, and you prevent that xerosis, that dryness, from happening. And when your feet are dry, which is one of the forms of neuropathy that our diabetic patients actually happen to have, then it leads to cracks, and this is favored by fungal infection, unfortunately. And we have to maintain, I would say, that moisturized feet to prevent, especially if you got a patient who has got autonomous neuropathy, dry feet, and yet does not have any mycosis. But if you're not treating it correctly, then this might lead to cracks favored by mycosis, actually.
So some of the common causes are, one is neuropathy. जब हम नर्व्स की बात करते हैं तो तीन तरह की नसें होती हैं. एक होती है सेंसरी, जो हमें बताती हैं कि जब मैं छू रहा हूं किसी को, तो वो सेंसरी नर्व्स हैं जो मैसेज भेजती हैं दिमाग तक कि कहाँ छुआ जा रहा है, कैसे छुआ जा रहा है. आपको कोई प्यार से छुए, कोई गुदगुदी करे, कोई गुस्से से छुए, आपको पता चल जाता है, आपके ब्रेन को पता चल जाता है. यू कैन नो वेदर यू आर बीइंग टिकल्ड और वेदर यू आर बीइंग स्लैप्ड, राइट. सो ये सेंसरी नर्व्स हैं जो काम करती हैं. मोटर है जो हमें काम करने के लिए बोलती हैं. जैसे अब मैं अपना हाथ उठा रहा हूं, ये मोटर नर्व्स काम करा रही हैं. ऐसे ही पैरों में भी मोटर नर्व्स हैं. डॉक्टर साहब ने हमें क्या पढ़ाया कि जब ये मोटर न्यूरोपैथी होती है तो कई बार पैर की शक्ल बदल जाती है, पूरे पैर की शक्ल बदल सकती है, हड्डियां गल जाती हैं. इसको शार्को आर्थ्रोपैथी बोलते हैं. ये एक्चुअली नर्व्स की बीमारी है. या मान लो सिर्फ अंगूठे में हुआ, पैर के बड़े अंगूठे में, उसको हैमर टो कहते हैं, या क्लब टो. ये अलग अलग शक्ल बदल जाती है पैर की. ये है मोटर न्यूरोपैथी. तीसरा उन्होंने जो वर्णन किया वो है ऑटोनॉमिक न्यूरोपैथी. ऑटोनॉमिक न्यूरोपैथी जैसे हमें बताता है, नसें हैं जो हमें बताती हैं भी कब पसीना आए, कब ना आए, ठंड से कैसे बचें, गर्मी से कैसे बचें, ये बॉडी ऑटोमेटिकली कर रही होती है. जब यहाँ पे न्यूरोपैथी होती है, गड़बड़ हो जाती है, तो फिर कई बार ये स्किन ड्राई हो जाती है. एंड एक बार ड्राई होनी शुरू हो जाए, वीक हो जाए, तो फिर उसमें इन्फेक्शन आएगी. The commonest infection is fungal infection, like Dr. Yovan told us. And once it keeps on, once it begins, actually, it becomes a vicious cycle. Isn't that right, Dr. Yovan?
Yeah, that's it. Yeah, it's exactly that.
Garika ji also said that, and Kedar Joshi ji also said एड़ियां फट जाती हैं, गहरी भी हो जाती हैं. It can become quite deep. So what do you do? The answer we've got from Dr. Yovan, that is use moisturizing cream. Now, Dr. Yovan, when do we use moisturizing cream? Do we use it before a bath or after a bath?
Well, actually, once before the bath, would be the feet will be still dry. But after the bath, actually, once you have dried your feet, you will see that after a few hours, actually, it will tend to dry out again. So you can use it a number of times during the day. Actually, there's no specific time, I would say, when you should do it only once or twice. So many times, 2 to 3 times per day, I tell my patients. Yeah.
Depends upon the season also. If you're in North India, अगर आप North India में हैं, उत्तरी भारत में हैं, तो सर्दियों में तो दिन में 3-4 बार करना पड़ेगा आपको. Once will certainly not be enough. And otherwise, after taking a bath, if you apply a moisturizing cream, आपकी स्किन थोड़ी सी रिलैक्स्ड होती है, नमी होती है स्किन में. तो मॉइस्चराइजिंग क्रीम जब आप लगाएंगे तो वो मॉइस्चर को रिटेन करेगा. इट विल रिटेन द मॉइस्चर. अगर आप नहाने से पहले तेल लगाते हैं, और उसके तुरंत बाद नहा लेते हैं तो वो तेल भी गायब हो जाएगा, पानी के साथ इतना ज्यादा फायदा नहीं होगा, यू वोंट हैव कॉस्ट बेनिफिट, वो तेल सारा बह जाएगा। तो नहाने के बाद एक्चुअली करना थोड़ा सा बेटर रहेगा। सम पीपल डू यूज ग्लिसरीन। ग्लिसरीन इज हाइग्रोस्कोपिक। ग्लिसरीन जो है वो नमी को खींचता है स्किन से। तो अगर आपके स्किन के डॉक्टर ने आपको ग्लिसरीन कही है इस्तेमाल करने के लिए तो जरूर इस्तेमाल करें, बट खुद ओटीसी ओवर द काउंटर ग्लिसरीन खरीद के ना इस्तेमाल करें। Any other good moisturizing cream will help. Pratima Srivastav has the best advice for us for today, and she says, just take care of your feet the way you take care of your face. It's as simple as that. What do you think, Dr. Yovan? Isn't that great?
Actually, I tell my patients that your feet are like your children. You should look at them every day. You should take care of them every day. Your feet are just like your children. Actually, you should be very, very careful and take very good care of them.
प्रतिमा जी, डॉक्टर योवन की तरफ से और मेरी तरफ से भी ये जो आपका है ना सेंटेंस, टेक केयर ऑफ योर फीट द वे यू टेक केयर ऑफ योर फेस, हम इसको श्रीवास्तव थ्योरी के नाम से अब हम यूज करेंगे अपने लेक्चर्स में, एंड आई एम श्योर डॉक्टर योवन विल यूज इट मेनी मेनी टाइम्स। द श्रीवास्तव, प्रतिमा श्रीवास्तव जी, मैडम हैं कहाँ से आप एक बार बताएं, तो वो भी हम यूज करेंगे अपने लेक्चर्स में। एकता विज हैज अ क्वेश्चन अबाउट द Zoom OPD टाइमिंग। सो ऑनेस्टली एकता मुझे पता नहीं है, बट रितु है हमारे साथ बैक स्टेज। आई विल रिक्वेस्ट रितु टू सेंड अ मैसेज एंड आई विल आंसर इट। Anisha has a question for you. Lots of many questions also coming up, Dr. Yovan. So Umesh Kumarji says that hydration is important to avoid cracked heels. Can you talk about hydration, dehydration? And Umesh, on the 15th of July, we will have a session, a talk show with Dr. Navneet Agarwal on summer related issues and heat related issues, जहाँ पे हम hydration की भी बात करेंगे. But otherwise, Dr. Yovan, in Mauritius, how common is dehydration, heat exhaustion?
It's very common. As you know, during summer, we tend to have temperatures like 35, 36 degrees. It is quite common. It's quite common, and we have an aging population, as you know, and the elderly. Sometimes they are not often educated enough by us doctors and other medical practitioners towards taking more care of their feet, and I think moisturizing your feet, keeping your feet I mean, in a humid state and not really in a dry state is a very important thing, and we have to remind each and every time our patients in the foot care unit about that.
Yeah, the point raised by Umesh Kumar ji is really really important. Hydration मतलब पानी का पूरा होना शरीर में। अब गर्मियां हैं आजकल, we are in summer months here in India. Mauritius is quite cool, I think, right now.
Yeah, well, we are in winter, but it's 20 degrees, so
मॉरिशियस जो है वो उनका जो मौसम है हमसे उल्टा चलता है, समर विंटर में उलट है। हाँ, एक्चुअली राइट नाउ वी ऑल शुड बी इन मॉरिशियस, मौसम वहां का बहुत सुहाना है। हाइड्रेशन की बात करते हैं, गर्मियों में प्यास लगती है तो हम पानी पूरा पीते हैं, मगर हम भूल जाते हैं कि हमारे पसीने में बहुत सारे पदार्थ, बहुत सारे अलग अलग तरह के नमक निकल रहे हैं, वो नमक की कमी भी हो जाती है। तो याद रखें गर्मियों में कि पानी के अलावा थोड़ा सा नमक भी ले लें। जलजीरा, नींबू पानी, शिकंजवी, गोलगप्पे का पानी, that's my favorite, Dr. Yovan, golgappe, but because of lockdown we can't go now and eat fresh golgappa. So
I'll have that when I come to India.
When you come to India. कोकम जूस is important. ये सब चीजें भी ले सकते हैं और अपनी स्किन का ख्याल रखना है। बट हाइड्रेशन की एक उल्टी साइड भी है, उसको इंग्लिश में कहते हैं इडीमा या पैरों की सोजिश। सो डॉक्टर योवन, लेट्स से somebody has swelling of the feet. I woke up in the evening when I took off my shoes. I just saw that my feet had swollen, right? The whole day I was fairly okay in my shoes, but then I took them off. In the evening I had to go to a party, and then when I tried to wear my shoes, they just didn't fit. What is this? Then when I wake up in the morning again, I am fine. So what are the reasons of this edema, this swelling of the feet?
So, well, of course, you have got many different reasons for pedal edema. I would say that one of the most, I'm not going to go through all the potential causes, of course, congestive heart disease, CRF, all the diseases, but I would say more commonly, I would say in the non-pathological state would be varicose disease, I would say. That is quite an orphan disease. And sometimes I get quite a lot of patients who come to see me who are on the amlodipine, for example, and who are getting pedal edema. because of amlodipine and other calcium channel blockers. And sometimes I don't know if that has been documented or not, but I try to switch to some other antihypertensive medication when I see these, especially varicose ulcers. I try to switch to other drugs, and it kind of helps actually when you decrease this edema in
Yeah.
treating these patients
Yes.
with varicose ulcers when you've got amlodipine-induced pedal edema. Yeah.
So we are talking today about foot care with a focus on diabetic foot care, and Dr. Yovan has raised many points where we try to explain why the feet can get swollen. डॉक्टर साहब ने लफ्ज किया यूज किया नॉन पैथोलॉजिकल. जो पैरों की सोजिश है जरूरी नहीं कि वो बीमारी हो, उसका ख्याल जरूर रखना है. अगर आप सोजिश कम करेंगे तो डिस्कम्फर्ट कम हो जाएगा, तकलीफ कम होगी. एक रीजन सर ने बताया कि कई बार जो ब्लड प्रेशर की दवाइयां हैं या शुगर की दवाइयां, एग्जाम्पल एम्लोडिपिन, एग्जाम्पल पायोग्लिटाजोन, इनसे पैरों में सोजिश हो सकती है. तो अपने सबसे पहले तो अपने डॉक्टर को पूछें कि मैडम या सर कोई ऐसी दवाई है बीपी या शुगर की जिससे शायद पैरों में सोजिश हो. दैट्स द सिंपलेस्ट. एक और डॉक्टर साहब ने पॉइंट रेज किया, इंडिया में ये बहुत कॉमन है और मॉरिशस में भी, इसको बोलते हैं वेरिकोज वेन्स. तो पैरों में सोजिश, और अगर आपको दिखाई दे कि नीली नीली नसें जो वेन्स हैं, नीली नीली नसें दिखाई दे रही हैं पैरों में, टांगों में, घुटनों के पीछे, तो ये वेरिकोज वेन्स भी हो सकता है. So that's another cause. There are at least two more non-pathological causes that we see very frequently in India. One is excessive salt intake. अगर आप कांजी पिएंगे खूब सारी सर्दियों में, kanji is Yovan, it's carrot juice with lots and lots of sugar, salt in it.
Okay.
Fermented carrot juice with salt. It is quite tasty. And the problem is no one can stop at one. So सर्दियों में आपने कांजी पी ली बहुत ज्यादा, गर्मियों में खूब सारी नमकीन लस्सी पी ली. You take a lot of salted buttermilk with less milk and more salt. So this can also cause edema. How you will get to know whether it's because of that? You just stop taking salt the next day, and then your swelling will disappear. नॉन पैथोलॉजिकल में ये भी होता है कि शाम तक सूजन हो जाती है, पर सुबह जब आप उठेंगे तब सूजन नहीं होगी. इसका एक ये भी पॉइंट है, वी लास्ट डॉक्टर योवन अबाउट हाउ टू बाय शूज एंड व्हेन टू बाय देम इन डायबिटीज, बट ये है नॉन पैथोलॉजिकल. एक जो इशू है इंडिया में, शायद मॉरिशस में नहीं दिखाई देती, बट वी मस्ट रेज दिस, ये है प्रोटीन की कमी. तो अब पुराने जमाने में एक बीमारी होती थी क्वाशियोरकर, अफ्रीका में भी और इंडिया में भी. क्वाशियोर का मतलब है प्रोटीन की इतनी कमी कि सारा जो पानी है शरीर का, जो खून की नसों में के अंदर रहना चाहिए, वो बाहर निकल आता है क्योंकि प्रोटीन उसको रोक नहीं पाता. हमारे यहाँ ये पेशेंट्स में बहुत कॉमनली दिखाई देता है. अगर आप वेजिटेरियन हैं और आप दूध भी नहीं पीते और आप पनीर भी नहीं खाते, तो प्रोटीन आएगा ही नहीं कहीं से. प्रोटीन की जब कमी होती है तो पैरों में सोजिश दिखनी शुरू होती है. पैरों में इतनी नहीं दिखाई देगी, आपको टांगों पे ज्यादा दिखाई देगी, ओवर द काफ मसल्स. और इसका डायग्नोसिस और इलाज क्या है? हम एक 24 आवर रिकॉल 24 घंटे का या 72 आवर रिकॉल 72 घंटे का हिस्ट्री लेते हैं कि आपने क्या खाया क्या नहीं खाया. उसमें जो डाइटिशियन है वो काउंट कर लेंगे कि आप कितने ग्राम प्रोटीन खा रहे हैं. सही मायने में प्रोटीन होना चाहिए 1 ग्राम ऑफ प्रोटीन per kg per day. So Dr. Yovan, is that right for Mauritius as well? So what's the kind of protein intake that you see in Mauritius?
Well, we don't really have problems like to the extent of kwashiorkor, just like you were mentioning. But I would say in terms of protein intake, even my vegetarian patients, they have a lot of dairy products. So it is less common actually in Mauritius. But salt intake is a problem. Yeah.
Salt कम करें. प्रोटीन का, अगर आप वेजिटेरियन भी हैं और आप दही पनीर दूध नहीं ले रहे, so you're not taking, you're vegan or partially vegan, then this protein deficiency will come. How you diagnose is by just checking how much protein you ate, right? And if it's not enough, we increase. We also have online with us Aman Sachdeva, who is one of the most handsome boys in Haryana, and he eats lots of proteins, that I know for a sure. So Aman is smiling right now, I'm sure. So these are some reasons for edema, for swelling. कभी कभी पर पैथोलॉजिकल रीजंस भी हो सकते हैं, किडनी डिजीज, थायराइड. तो अगर नमक बंद करने से और प्रोटीन ज्यादा खाने से सोजिश नहीं ठीक होती, तो फिर एक थायराइड और किडनी का डिजीज, किडनी का टेस्ट जरूर करवाएं. There are other issues also that are there, and we have lots and lots of messages and comments for you, Dr. Yovan, and lots of appreciation as well. So
Thank you.
Pratima Srivastav ji says that using moisturizing cream for sure after a bath because it gets absorbed better on a wet skin. On a dry skin, देखो आपका हाथ भी ड्राई है, आपका पैर भी ड्राई है. जब आप मालिश करेंगे मॉइस्चराइजिंग क्रीम तो आधा तो आपके हाथ पे ही चल जाएगा. तो पैर को थोड़ा सा गीला किया हो जैसे नहाने के बाद, और फिर जब आप मलेंगे तो स्किन में ज्यादा मॉइस्चराइजिंग क्रीम जाएगी. There is a question from Poonam Grover ji as well as Anisha Vincent ji, a similar question. Sometimes we have tingling or burning in the feet. या पैरों में खुजली. खुजली would mean pruritus or itch. So tingling, burning, itching. What can we do? How can we make ourselves more comfortable?
Yes, so tingling, burning sensation is what we call in the medical term, like is under the common name of what we call paresthesia, and this can be of a different nature, as you were saying. So these are a few forms in which you could describe it. Actually, it's linked to the glucose. Mostly, it's linked to the glucose imbalance in the first place. It can be hyperglycemia, chronic hyperglycemia, but it could be hypoglycemia also that can give you neuropathy. So it's both spectrum. So I have seen quite a few patients who are getting actually who knew that they were in hypoglycemia because they were having these tingling, burning sensations actually. So it can be both spectrum, but it tends to be quite more because of hyperglycemia. But also one thing that we need to think about is vitamin B12 deficiency, which is quite common, especially with chronic treatment with metformin. As we know, it tends to lower a bit the B12 levels that we have. So I think it would be a good idea to check from time to time the B12 levels, just to see whether this cannot be a contributing factor in terms of the tingling, the burning sensation, etc. As far as pruritus is concerned, most of the time it is due to the xerosis, it's due to the dryness of the feet, or it is due to the fungal infection itself. And pruritus is interesting in the sense that it tends to itch at specific places, sometimes in interdigital space. And these are when you find that you have pruritus in these specific spaces, it tends to be more often fungal infection.
Fungal. तो डॉक्टर साहब ने 4 कारण बताए. अगर हमें ये कारण पता चल जाए तो हम इलाज भी कर सकते हैं खुद. पहला कारण डॉक्टर साहब ने बोला शुगर या डायबिटीज. ज्यादा शुगर हो तो भी ऐसे सुइयां चुभ सकती हैं, जलन हो सकती है, दर्द हो सकती है, खारिश हो सकती है. कम शुगर हो तो भी. तो इसका इलाज है कि अपनी शुगर ठीक रखें, नियंत्रण में रखें. कीप योर ग्लूकोज अंडर कंट्रोल, एंड वी कॉल दिस ग्लाइसेमिक हाइजीन. सेकंड जो कारण डॉक्टर साहब ने बताया वो बताया विटामिन B12 डिफिशिएंसी. डॉक्टर साहब हंसेंगे हमारी स्टोरी सुन के, मगर पहले इंडिया में विटामिन B12 डिफिशिएंसी नहीं हुआ करती थी. रीजन ये था कि विटामिन B12 जो है वो एनिमल किंगडम से आता है. विटामिन डी और विटामिन B12 और एक विटामिन B1 है जिसकी कमी पहले जापान में हुआ करती थी. ये 3 विटामिन है. जैसे जैसे आप अमीर होते जाते हैं वैसे वैसे ये विटामिन डिफिशिएंसी बढ़ती है. तो B12 की स्टोरी ये है कि पहले हम कुएं का पानी पीते थे, नदी का पीते थे, तालाब का पीते थे. We used to drink water from the well, from the river or from the pond. उसमें इतने सारे बैक्टीरिया होते थे, तो बाकी तो जो पेट का जो हाल होता था, जितने भी कीड़े कीटाणु पेट में जाते थे, whatever gastroenteritis and cholera you had, that was a separate matter, but B12 वो पूरा कर देते थे शरीर में. Now we have clean drinking water. अब हम आरओ का पानी पीते हैं, बिस्लेरी पीते हैं. सो अब B12 हमारा खत्म हो गया. सो इफ यू आर अ वीगन, अगेन आप वेजिटेरियन हैं और डेयरी फूड्स भी नहीं लेते, तो विटामिन B12 का कोई सोर्स नहीं रहता बॉडी में. सो यदि आप वेजिटेरियन हैं और डेयरी फूड्स भी कम लेते हैं तो विटामिन B12 रेगुलर इंटरवल्स पे लेने में कोई हर्ज नहीं है. इट्स अ सेफ विटामिन. ये जरूर याद रखें कि बहुत ज्यादा अगर आप विटामिन B6 लेंगे तो उससे भी न्यूरोपैथी हो सकती है, उससे भी नर्व्स को पॉइजन हो सकती है. So that was the second point which Dr. Saab raised for us. The third point he raised was he used the term xerosis. XEROSIS. Xerosis मतलब ड्राई होना स्किन का. उसका पहले ही डॉक्टर प्रतिमा जी ने भी हमें जवाब दिया, मॉइस्चराइजिंग क्रीम आफ्टर अ बाथ. तो वो तो हम करेंगे ही करेंगे, ड्राई स्किन से बचेंगे. मगर डॉक्टर साहब ने फिर रेज किया कि अगर कुछ कुछ जगह पे आपको खारिश हो रही है, खुजली हो रही है, इट माइट बी फंगल इन्फेक्शन. a localized dermatosis. तो हिंदी में लफ्ज यूज किया जाता है सूखी खारिश, सूखी खुजली, which means a dry itch. What the patient is trying to tell us is that there is no skin lesion, still I am itching. It can be a neuropathy, it can be psychological, there can also be an underlying dermatosis. एक skin disease नीचे हो सकती है जो हमें दिख नहीं रही. कई बार मरीज इस्तेमाल करेगा लफ्ज गीली खुजली या गीली खारिश, where what he is trying to tell you is that there is a lesion, so please see the lesion for me. The lesion can be there all the time, then probably it's an infection. The lesion can come and go. अचानक खारिश हुई, खूब सारे लाल लाल धब्बड़ बने, lots of red spots, and फिर वो चले गए. It might be a mosquito bite, it might be an allergy to something that you ate. So these are the common reasons, and if we figure out the reason, we can easily treat it. The question was raised about free OPD, so allow me to give the phone number also. So the Zoom number, the Zoom ID for Healthcare Foundation of India, free COVID-19 OPD, रोज free COVID-19 OPD होती है 3 बजे से 5 बजे, 3 p.m. to 5 p.m. all days, and the Zoom ID is 8429 8429 0921 0921 517 517 8429 0921 517. अगर इमरजेंसी है तो यू कैन लॉग इन बिटवीन 10:30 AM and 12 noon, 10:30 से लेके दोपहर 12 बजे तक भी कर सकते हैं. So thank you Ritu for giving that answer. Dr. Sharda adds to what you said, Dr. Yovan. He said that you can apply Vezele. Sir, आपको हमें पढ़ाना पड़ेगा VEZELE application. After that you can wear socks and this will help cracked feet. Dr. Yovan, any insights on this?
Actually, I'm not really familiar with that.
So we'll learn from Sir. Sir will teach us in a few minutes. Yeah.
But maybe one thing I would like to add, maybe Sanjay, if you allow me, it's I've seen a few patients with psoriasis, palmoplantar psoriasis, where you've got a hyperkeratotic feet and hands also. And it's one of the forms of severe xerosis. I think we should think about psoriasis is quite common, and I think we should think about this possibility when you have got a hyperkeratotic soles, especially if it maintains this this dryness despite moisturizing creams, etc. We should think about that. Yeah.
So Dr. Sahab has put in another diagnosis. अगर आपकी शुगर भी ठीक है, आपके विटामिन्स भी ठीक हैं, फिर भी आपको खारिश हो रही है और छोटे छोटे सिल्वरी स्केल्स, जैसे मान लो आपने साफ की कोई मछली, ऐसे छोटे छोटे सफेद सफेद रंग के या सिल्वर कलर के स्किन के पीसेस उतरते हैं बार बार, कभी बढ़ जाएगा कभी घट जाएगा. बीमारी का नाम है सोराइसिस. तो एक बार स्किन स्पेशलिस्ट को दिखाएं. And if you remember right at the very beginning, Dr. Yovan said the challenge of foot care is that you need a multidisciplinary team. कुछ एक चीजें सर्जन करेंगे, कुछ एक डॉक्टर करेंगे, कुछ नर्स करेंगी, कुछ स्किन स्पेशलिस्ट करेंगे. Poonam Grover ji also reminds us, thank you madam, that your feet show how you carry yourself, because if your feet are clean, you yourself will be clean from inside. And आप अपने फेस को छुपा सकते हैं, उस पे फेस मास्क या पॉलिश कर सकते हैं, बट पैरों से पता चलता है हाइजीन का स्टेटस. एंड डॉक्टर प्रतिमा, थैंक यू मैडम सो मच. सो योवन, द श्रीवास्तव थ्योरी और द श्रीवास्तव कोट, Dr. Pratima's madam is a gynecologist in USA right now. So you have a new friend in the US as well, Yovan. So okay. US, Belgium, Mauritius, India, everywhere. And Dr. Srivastav has studied at Lady Harding in New Delhi. So thank you, madam, for joining us. Thanks a lot. So that Srivastav quote was, treat your feet the way you would want to treat your face. A question from Sharma, Madam Sharma, Nandini Pokhriyal Sharma. Sometimes my foot skin is sticky when I walk. Is it related to diabetes? A stickiness in the feet?
It could be hypersudation, which is another form of autonomic disease. It could be some form of infection also. So yes, again, I think it would be interesting to bring in a skin disease specialist in these circumstances to see whether there is any underlying disease, skin disease in these circumstances. Yeah.
So Nandini ji, Dr. Sahab कह रहे हैं कि it might be related to diabetes. डायबिटीज की वजह से ऑटोनॉमिक न्यूरोपैथी होती है, उसकी वजह से कई बार पसीना ज्यादा आता है जहां नहीं भी आना चाहिए. तो स्किन स्पेशलिस्ट को दिखा दें या शुगर वालों को दिखा दें। अगर आप पसीना कम करना चाहते हैं तो एक देसी इलाज, वन फोक रेमेडी इज एलम, एल्यूमिनियम हाइड्रोक्साइड। इसकी हिंदी है फिटकड़ी। तो जो जेंट्स हैं हमारे साथ, जब आप शेव कराने जाते थे पहले, अब तो सब सैलून में जाते हैं, पर पहले अगर आप शेव कराने जाते तो जो नाई भाई साहब हैं वो इस्तेमाल करते थे फिटकरी। इट्स एन एंटीसेप्टिक, एल्यूमिनियम हाइड्रोक्साइड। सो यू कैन ट्राई एलम, एल्यूमिनियम हाइड्रोक्साइड, फिटकरी मल ले नहाने के बाद, सी इफ द स्वेटिंग और दैट स्टिकीनेस कम्स डाउन। If it doesn't come down, then we must show a doctor. Dr. Sharda also reminds us that anemia and postural hypotension, these are also causes of poor circulation to the feet, which can also predispose to infection. Gariga ji has a question for you. So he says that we spoke about salt. So which salt is the best? Should I use normal salt, or in India we have lots of salts, Yovan, Himalayan salt, rock salt, kala namak, black salt, so different types. Or should we use the iodized salt?
Well, what I tell my patients, actually in Mauritius, just to take the local context, sometimes we tend to say, okay, switch from NaCl, which is the sodium chloride, which is the basic salt, to KCl, which is in my sense not a good substitute. Because it can lead to other problems. I think the most important problem is in terms of quantity of whatever salt we're taking. The quantity is prime. Whichever type of salt that you're taking, the basic thing is sodium chloride, and all problems that will be coming on top of that would be following the quantity of what you're taking. Of course, you could argue that those who are taking iodinated salt would be interesting for those who are hypothyroid patients, but again, at some point, how much is too much? So I would say that in our daily food consumption, especially if you have access to seafood, etc., you have got enough of iodine in your seafood. You're not forced to take iodinated salt. It's very rare, maybe with us, especially for iodinated salt.
हाँ, ये मेजर डिफरेंस है मॉरिशस और इंडिया में। तो देखो डॉक्टर साहब ने क्या कहा, इफ यू आर नियर द सी, इफ यू हैव एक्सेस टू सी फूड, यदि आप फिश खाते हैं रोज, ये नहीं कि महीने में एक बार खाई या हफ्ते में एक बार खाई, इफ फिश और सी फूड इज एन इंटीग्रल पार्ट ऑफ योर डाइट, देन यू विल हैव एनफ आयोडीन। कोई भी नमक ले लें। बट इफ यू आर लिविंग इन इंडिया अवे फ्रॉम द सी, राइट, इनलैंड, and you are not eating fish every day, then you do need iodine, and iodinated salt is the best to take. उसमें sodium chloride होता है. You can take pink Himalayan salt. The laughter about that also again, Dr. Yovan हंसते ही रहेंगे हम पे आज तो, एंड डॉक्टर प्रतिमा भी हंसेंगे हम पे. बट द पॉइंट इज कि हिमालय अब कितने लाखों सालों से है, बट जब हम हिमालयन सॉल्ट खरीदते हैं, इट कम्स एज अ प्रीमियम. इट्स अबाउट 10 times more expensive than iodinated salt, than iodized salt, Yovan. And they have an expiry date also, that is next year. So as long as the salt was in the Himalayas, it lasted for lakhs of years. The moment it comes in a bottle, then the shelf life is 1 year. So that we've not been able to figure out why that happened. So iodized salt, but in limit. And but Gariga, thanks for taking this up, and we'll take this up in a talk show. Maybe in the next month, we'll talk about salt and sugar and spices. Salt, sugar, spice, and all things not so nice and nice. But then Dr. Pratima reminds us about nice things. Rajma and chana dal have lots of proteins, so eat these daily. Thank you, madam, for that. And if you have tingling and burning, so Dr. Pratima is answering Poonam ji and everybody else, then take neurotropic vitamins. You can take a B complex. And if it doesn't work, then go to your doctor. There are many drugs like gabapentin, pregabalin. Talk with your doctor. Start in a low dose, build up slowly. A couple of more questions for you, Dr. Yovan. One which is slightly out of syllabus. So Geeta Khialani ji, madam ji, she asks, swelling in the ankle and the left elbow, painful and swollen. So what are the possible reasons for this? Whom should she consult?
It could be different causes. Now, when you're talking about the ankles and the you were saying the ankles and the, sorry, Sanjay?
Ankle and elbow.
Elbow. So we should look specifically at what is the location of the swelling. Is it what we call a bursitis? Is it a specific swelling of the articulation itself? I mean, is it intra-articular or is it extra-articular? Are we looking at gout, Are we looking at something more rheumatological? I would say autoimmune diseases. I think there are a few investigations plain investigations that we could do, X-rays, etc., and basic investigations and a few blood tests. But if you're looking at multiple articulations in this way, lower limbs and upper limbs, then probably it's more something that is systemic. That's something that is limited to a single disease. So yeah.
But अगर तंग हो रहे हैं तो I think a good workup is required. I mean, show a doctor
exactly.
and get the test done.
Exactly. Yeah.
Some more best practices coming in from USA. आज तो बहुत मजा आ रहा है, पूरा ना वो multinational, almost United Nations style वाला हमारा वो talk show चल रहा है. But Dr. Pratima says a very good practice. I never thought of it actually, madam. Madam rotates the use of all salts, iodized, pink Himalayan, sea salt. So benefits of different salts at all times. But she reminds us that the less, the better. So limit yourself to 2.3 grams of sodium or 5 grams of salt per day. अब जो इंडियन क्यूजीन है और जो मॉरिशस की भी क्यूजीन है उसमें खूब सारा नमक होता है, थोक में होता है. So 3 P's that you must avoid. Again, this best practice coming in from Dr. Srivastav. Avoid papad, pickle and pakoda. Papad, pickle, pakoda. Also avoid chutneys and tomato ketchup. अगर आप 1 चम्मच टोमेटो केचप लेंगे उसी में ही आपका दिन का आधा जो सॉल्ट इंटेक है वो पूरा हो जाता है. So reduce tomato ketchup. It has sugar, it also has salt. So both are dangerous in excess. 3 सब्जियां जो बहुत सारा घी या तेल खींचती हैं और बहुत नमक खींचती हैं. करेला, बिटर गोर्ड और बिटर मेलन, कटहल, जैक फ्रूट और कड़ी. तो जब हम करेला, कटहल या कड़ी बनाते हैं, the way in which we usually cook them, that involves a lot of oil and a lot of salt being used in the cooking, in the cuisine. So we should be avoiding that as well. Don't take too much of it. Dr. Pratima tells us that pink Himalayan salt comes from the mountains in Pakistan and in India as well, madam. And there are many videos on YouTube on how pink Himalayan salt is harvested. That's right. And Yovan ji, it's almost 8. So warm greetings to you from Rekha Sharma ji. Nandini ji says thank you. Let's take up a couple of more questions. And I know you are busy, you have to leave. केदार जोशी जी कह रहे हैं, मेरा बेटा अभी 30 साल का है. जब वह खड़े होकर कुछ भी काम करता है, whenever he stands up and tries to work, आधे घंटे के बाद उसके पैरों में दर्द हो जाता है. He gets pain 30 minutes after standing. ये परेशानी बहुत सालों से है. केदार जोशी जी, इसको मैं लेता हूँ. सबसे पहले तो जूते बेटे के. See what kind of shoes he is wearing, what kind of footwear he is wearing. दूसरा देखें कि दोनों पैरों पे बराबर का बोझ है या नहीं है. एंड न्यूट्रिशनल ऑप्टिमाइजेशन, कैल्शियम, विटामिन डी, बोन्स स्ट्रांग है या नहीं, बी कॉम्प्लेक्स, विटामिन बी, न्यूरोट्रॉपिक विटामिन्स. इन सिंपल चीजों में एक बार देखते हैं. लेट अस नॉट गो इनटू मेडिकल स्टफ. लेट अस लुक एट द फुटवियर. अगर आप शॉप्स पे जाएंगे, कई शोरूम्स में शू इंजीनियर होते हैं जो आपके साथ बैठेंगे, आपको बोलेंगे, हाँ जी सर जी, आपका पैर इस तरह का है, आप ऐसे वाली चप्पल खरीदें. आपका पैर उस तरह से बना है, वैसे वाली चप्पल खरीदें. यू कैन ऑल्सो गो ऑनलाइन एंड गेट you can get customized shoes for yourself. Many of the athletes do that actually. So that also, मतलब बेटा ये try कर सकते हैं. अभी तो एज भी छोटी है. He is just 30. He has a long way to go. So I think he should invest on this. Yeah.
Maybe one thing that if you see a podiatrist, you can do you do a podometer test. So with the podometer, you can see the specific points of pressure. And I have a few patients who do that. They have made specific insoles following podometric tests, so that to limit the points of pressure actually. Yeah.
So show a podiatrist or a foot specialist, and they will also help you find the pressure point. Supposing आप नहीं दिखा पाते, कोई है ही नहीं आपके आसपास, तो एक रिक्वेस्ट रहेगी, हर 2-3 घंटे पे अपने जूते बदल लें. You are wearing shoes in the morning, change after 3 or 4 hours. Just keep on changing your footwear. Automatically, you will get to know which is more comfortable, which is not so comfortable. A few more comments coming in from people. Nandini ji asked about diabetes and sugar. So, madam, एक तो चाहे age 0 years हो, चाहे 100 years हो, diagnosis of diabetes is the same. 3 तरह के टेस्ट होते हैं. फास्टिंग, पोस्ट ग्लूकोज, 75 ग्राम ग्लूकोज लेके 2 घंटे के बाद शुगर चेक करना, और HbA1c. तीनों ही कराने चाहिए. कोई भी 2 करा लें, वो पॉजिटिव आ जाए तो फिर डायबिटीज डायग्नोज होती है. अगर सिम्टम्स नहीं है, इफ यू आर एसिम्टोमेटिक, कोई भी दिक्कत नहीं है, कम से कम 2 टेस्ट होने चाहिए खराब, तभी शुगर डायग्नोज की जाएगी। मगर अगर तबीयत खराब है, पहले ही दिख रहा है तबीयत खराब है, सिंगल टेस्ट पे भी आप इलाज करना शुरू कर सकते हैं। And Dr. Pratima, like I said, thank you so much for being with us. Shubhlata ji Chetwal ji is also with us, and sir has helped us out. He was saying Vaseline, so applying Vaseline like a moisturizing cream, this will help a lot. Thank you, Dr. Sharda sir. Always we are grateful for your insights. And Anjali ji, अगर sugar ठीक चल रही है, A1C is 6.5, I think her husband should continue the same medication, right? Dr. Yovan, yeah. इट्स लाइक जैसे आप गाड़ी चला रहे हैं, अगर गियर ठीक चल रहा है, गाड़ी ठीक स्पीड से चल रही है, तो गियर को ना बदले। इफ यू आर वेयरिंग स्पेक्टिकल्स, आपको ठीक दिखाई दे रहा है, डोंट चेंज योर स्पेक्स। सो इफ ग्लूकोज इज फाइन, A1C is 6.53, डोंट स्टॉप द मेडिसिन। इफ यू स्टॉप, इट विल एक्चुअली द शुगर्स विल गो अप। Geeta Kalyani ji also asked about glucose levels, so we've answered that. So today we've discussed so many things about foot care. There was one question about the fingers and infection in between them. Let me just take this. अगर यहाँ पे आपको infection है पैरों में, उंगलियों के बीच में, तो यहाँ पे आपने क्रीम लगा ली, मान लो एंटी फंगल, पर फिर ऐसे आपकी उंगलियां बंद हो गई, तो यहाँ पे मॉइस्चर भी आएगा, नमी भी आएगी, तो फंगस और उगेगा। तो अगर नहीं ठीक हो रहा है, इसका तरीका क्या है कि ऐसे अपनी उंगलियों को सेपरेट करें। यहाँ पे आप कॉटन बॉल डाल दें, एक रुई का गोला डाल दें, टिश्यू पेपर का गोला बना के डाल दें, कुछ भी कर दें, यू जस्ट सेपरेट योर टोज। यहाँ जो क्रीम लगेगी, क्रीम तो फायदा करेगी, मॉइस्चर उड़ जाएगा, फ्रेश हवा आएगी, और इस तरह से अगर आप अपने पैर ऐसे रखते हैं 2-4 दिन के लिए, वो फंगल इन्फेक्शन ठीक हो जाएगी। अगर हम ऐसे टाइट रखते हैं और टाइट जूते, सॉक्स पहनते हैं, जुराबे पहनते हैं, जो हम 24 या 36 घंटे नहीं उतारते, तो फिर तो वो इन्फेक्शन नहीं ठीक होने लगी। सो दैट वाज द आंसर टू वन ऑफ द अदर क्वेश्चंस। बट Dr. Yovan, how has been your day today? Just asking you, have you enjoyed interacting with all your fans from India, from USA, from Mauritius?
Yeah, it was a great
Oman.
meeting. Yeah, it was. Thank you for staging that, and it gives us the opportunity to as you say, around the world. And yes, enjoyed that very much. And I think that, of course, these always help us. And you've been having very interesting comments, very interesting insight from other people too. And we value these things. We value these things everywhere. And as a doctor, we value these things. As I was saying early on, it is all about multidisciplinarity. We have to seek about. We can't pretend to know everything, of course, and we have to seek knowledge from everyone, from everywhere. It's for the better of the patient. Yeah.
So, डॉक्टर साहब ने शुरुआत भी इसी से ही की थी। फुट केयर इज चैलेंजिंग बिकॉज इट इज मल्टी डिसिप्लिनरी, एंड भी इसी से ही कर रहे हैं। इट इज मल्टी डिसिप्लिनरी, मल्टी फैक्टोरियल. वी हैव टू वर्क एज अ टीम. But the best thing is that when we work together on Dr. K.K. Agarwal's MEDTalks shows, we actually become a team. We learn from each other. So we learned from Dr. Sharda. We learned from Dr. Srivastava. Madam is also saying that you can buy diabetic shoes. They are available in India and in Mauritius. Acupuncture soles are also good. But acupressure, madam, not acupuncture. So acupressure soles might work for some people. And also when you wear socks, make sure that the elastic on the top is loose. नहीं तो फिर swelling हो जाएगी नीचे. So, but the final comment actually comes in from Kamya ji, who says, hurry, curry and worry all are injurious. And that is right. Thank you for that insight. So don't hurry too much in life. थोड़ा सा relax करें. Curry में नमक थोड़ा सा कम. Reduce the salt and pepper in the curry. And worry we must रहे. I mean, so if you have tension, कुछ एक चीजें Dr. K.K. Agarwal's MEDTalks will clear for you. डॉक्टर युवन क्लियर कर देंगे हमारे लिए. हमारे सारे टीम मेंबर जो हैं, दे विल क्लियर. जो बाकी बचा फिर भगवान है, अल्लाह है, he will take care of us. What do you think, Dr. Yovan?
Yeah, that's a very good way to end the talk.
Yeah, but there was a question right at the beginning, and that was metabolic कर्म. कर्म means कि जो आप कर्म कर रहे थे, वो आपके आज के कर्म को बनाते हैं. जो आप कर्म अब कर रहे हैं, वो आपके कल के कर्म को डिसाइड करेंगे. So that is related to health. Let us follow healthy practices so that we are able to enjoy a healthy destiny, a destiny that is full of health. And with this, Dr. Yovan, we'd like to thank you a lot. Warm greetings, sincere thanks. बहुत मजा आया आपके साथ. It was fun. Ritu, could we please show a certificate of appreciation for Dr. Yovan, please?
Thank you very much. Thank you very much for inviting me. It was a pleasure. Maybe
Thank you.
if you would allow me, there's just one code that I found today
Yeah.
that was brought forward by the IDF, International Diabetes Association.
Mhm.
I think it fits the talk. Is their motto is the following: is that keeping people on their feet, walking, and mobile is fundamental to preventing the progression of lifestyle-related diseases. So I think that sums up a bit.
Let's repeat that, Dr. Yovan, for everybody. Keeping everybody on their
keeping
feet.
keeping people on their feet, walking,
पैरों पे रखें सबको, या
and mobile is fundamental to
चलते हुए,
preventing.
हाँ, पैरों पे खड़े होना है पर चलना भी है, मतलब
हाँ,
10,000
चलना
steps रोज चलनी है,
चलना भी है चलना भी है
चलना भी है,
is
चलना भी है।
is fundamental to preventing the progression of lifestyle related diseases.
और यदि हम ये कर लेते हैं, हम खड़े रहते हैं और हम चलते हैं, तो एक्चुअली हम लाइफस्टाइल डिजीज, जो बीमारियां हमारे रहन सहन की वजह से आ रही हैं, जैसे शुगर है मान लो, या ब्लड प्रेशर या मोटापा, इनसे हम बच सकते हैं। And so many pleasant comments and appreciation for you, Dr. Yovan, from all our listeners. So thanks a lot, and we hope to have you again with us on the show.
Sure.
And we hope to continue the Mauritius and India bhaichara as well.
Yes, looking forward to that. Thank you, Sanjay.
Yeah. And we have Dr. KK Agarwal's MEDTalks every day at 7 p.m. Dr. KK Agarwal सर थे, हमारे बहुत सीनियर डॉक्टर थे। अभी 1-2 महीने पहले सर चले गए, देहांत हो गया सर का बिकॉज ऑफ कोविड रिलेटेड कॉम्प्लिकेशंस। तो वो इश्यू आ गया, बट जाते जाते वो कह गए द शो मस्ट गो ऑन, एंड दैट्स व्हाट वी आर ट्राइंग टू डू। सो एवरी डे एट 7 p.m. मैं आपके साथ होता हूँ हर सोमवार और वीरवार, एवरी मंडे एंड थर्सडे। आई विल बी विद यू अगेन ऑन द 8th of July, दैट इज थर्सडे। वीरवार को फिर होऊंगा आपके साथ। डॉक्टर योवन को हम जरूर बुलाएंगे और वो भाईचारा हम अपना बनाए रखेंगे। डॉक्टर प्रतिमा, इफ वी कैन हैव योर कॉन्टैक्ट, हम आपको भी बुलाना चाहेंगे MEDTalk शो पे, ऑल द वे फ्रॉम USA, इफ द टाइम सूट्स यू। So thank you everybody once again, and we'll meet again. Don't forget to tune in to Dr. KK Agarwal's MEDTalks every day at 7 p.m. I'll meet you again on Thursday, 7 p.m. with a surprise guest. Thank you and Jai Hind. Jai Mauritius.
Bye-bye.
Yovan, what's the Jai Hind equivalent of Jai Mauritius? Vive la Maurice.
Glory to thee, Mauritius.
Glory to Mauritius, and Vive la Maurice will be in French. उसको तो हिंदी में बोल दें, Yovan.
You say that in Hindi.
Mauritius Zindabad.
Mauritius Zindabad.
Zindabad.
Say that.
So on that note, Jai Hind and Mauritius Zindabad, we conclude today's shows. Thank you everybody, and meet you again.
Thank
Goodbye.
you. Take care. Bye-bye.
Bye. Bye.